Welcome back. In this video, I'll talk about deep vein thrombosis and pulmonary embolism. Deep vein thrombosis, or DVT, is very commonly associated with pulmonary embolism. They're often grouped together under the umbrella of thromboembolic diseases. Basically, there will be a small thrombi in the veins, 70% of the time originating from the legs and 30% originating from the pelvis. And this thrombi will leave the vein and go all the way up to the lungs. Once they reach the lungs, they will block the blood flow to the lungs. So the patient will be breathing just fine because the airway is clear, but the lungs don't have any blood going to them. It's fairly ironic, suffocating while breathing. Once the clot clogs up some arteries in the lung, it will continue to grow as more and more blood cells will coagulate and form larger and larger thrombi. It's a very serious and life-threatening condition, and most of the time it is acute. Risk factors wise, think of anything that would increase the chance of deep vein thrombosis. Most commonly, stasis from immobility, surgery, trauma, or hypercoagulability state arising from factor V Leading mutation, or antiphospholipid syndrome. Malignancies are also commonly associated with DVTs. There isn't really any single best test that we should do because the case is very acute, it's an emergency, and the patient could die at any second. But good answers include chest X-ray, EKG, and ABG. The treatment is very clear and very important. You should immediately start the patient on any one of the NOAC medications or low molecular weight heparin, followed by warfarin. The medication andexanet reverses the action of NOACs. So if you do end up using too much NOACs, you actually have a reverse button. In certain patients that are highly susceptible to pulmonary embolism and DVTs, we can have an inferior vena cava filter. This is a small mesh that we install within the inferior vena cava, and it stops any clots from reaching the lungs. This is not an ideal treatment, but it's good to have as one of the options just in case you don't have any other option. And here's a small quiz. And here's the answer. Alright guys, that's all I have. Thank you so much for watching and hopefully this helped.